Welcome back. This is the second video in our series about Pinnacle Advanced Primary Care and our movement to revolutionize the way primary care is delivered. We're going to start with the very foundation of our practice model, which we believe is facilitating that collaborative partnership between us and our patients. Believe it or not, the word doctor actually means teacher, and that's a big part of what we do. I mean, we can write prescriptions and analyze tests and perform procedures, but we probably spend more time counseling patients about how they can best manage their illnesses. And we do this by helping them develop health confidence. Health confidence is a term that describes patient engagement and their comfort level in addressing issues related to their health. It may be the most important thing in all of medicine, at least in primary care. Health Affairs, which is the top publication on health policy, called Health Confidence the blockbuster drug of the century because higher health confidence improves patient outcomes, increases how satisfied patients are with their care, all while decreasing the cost of care. It actually addresses each of the three dimensions of the triple aim of the Institute of Healthcare Improvement. Well, let's review that. That means patients are healthier, they're more satisfied with their care, and their care is more cost effective. So when we started Pinnacle, this seemed like a pretty good place to start. And it makes perfect sense. It's intuitive that everything has to start with patient engagement and activation. And if you talk to patients, they know this. They love that feeling of knowing their care plan, knowing their role in fighting back against disease. So we wanted to make sure that the patients had access to the information that they needed whenever they needed it. That's why I started the Health Confidence Academy, a platform for video-based patient education. This is a sister company to Pinnacle Advanced Primary Care, which we'll be using to give you access to information. Think of it as your lifeline for general health information. We started with content covering preventive medicine, with articles and videos there with information about clinical preventive services. This includes things like cancer screenings, osteoporosis, screenings and preventive treatments for cardiovascular disease, and mental health screenings. There will also be programs in specific areas. Currently, we have the Heart Health Confidence Academy that has a crash course in nutrition and in exercise science, along with tips for consistency and success. And we'll just keep adding more of this type of content. We plan on having programs for mental health, diabetes care, child development, and many other programs in the future. And since you have constant access to the information, if you don't understand it the first time, you can just watch the video over again. When you get an explanation in the doctor's office that you don't completely understand, it's not like you can just go back there the next day, pull the doctor out of another exam room, and ask him to explain breast cancer screening again. With the Health Confidence Academy, you can review the material as many times as you need until you have a solid understanding. To help with this, we've got little quizzes after each video. They're about 5 to 10 questions each, and they help reinforce all the concepts that you've just learned. You can check out the Health Confidence Academy for yourself at myhealthconfidence.com. So this actually is the secret to our whole operation. By giving our patient base constant access to the information that they need in a really effective way, we improve their health confidence and foster that collaborative partnership. And as it's already been shown, that improves patient satisfaction, they have better health outcomes, and it decreases the cost of their care. In our next video, we'll be talking about how changing up the primary care business model gets rid of distractions and puts our focus back on your health. We'll see you then.